Welcome to another informative video by OC Management Consultants. Today, we delve into the intricate world of autism spectrum disorder, or ASD. From its definition to types outlined by the World Health Organization, we'll explore the medical, communication, and mental health needs of individuals with autism. Join us as we provide valuable insights and strategies for caregivers on this unique journey of understanding and support. Autism, also called autism spectrum disorder, is a serious developmental disorder that impairs the ability to communicate and interact. It is characterized by challenges with social skills, repetitive behaviors, speech, and nonverbal communication. Types of autism. According to the WHO, there are 5 major types of autism, which include Asperger's syndrome. A child with level 1 spectrum disorder will have above average intelligence and strong verbal skills, but will experience challenges with social communication. Rett syndrome. This is a rare neurodevelopmental disorder that is noticed in infancy. Rett syndrome presents challenges that affect almost every aspect of a child's life. Common symptoms of Rett syndrome include loss of standard movement and coordination, challenges with communication and speech, breathing difficulties in some cases. Childhood disintegrative disorder, or CDD, also known as Heller syndrome or disintegrative psychosis, is a neurodevelopmental disorder defined by delayed onset of developmental problems in language, motor skills, or social function. A child experiences normal development in these areas only to hit a snag after age 3 and up to age 10. The child may lose any of the following skills and abilities: toileting skills if they had already been established, acquired language or vocabularies, social skills and adaptive behaviors, some motor skills. Kanner syndrome. Children with Kanner syndrome will appear attentive, alert, and intelligent with underlying characteristics of the disorder such as lack of emotional attachment with others, communication and interaction challenges, uncontrolled speech, and obsession with handling objects. Pervasive developmental disorder. This is a mild type of autism that presents a range of symptoms. The most common symptoms are challenges in social and language development. A child may experience delays in language development, walking, and other motor skills. This type of autism can be identified by observing the child and noting what area the child displays a deficit. Medical needs of an individual with autism. Medications. According to Mayo Foundation for Medical Education and Research, or MFMER, no medication can improve the core signs of autism spectrum disorder, but specific medications can help control symptoms. As a carer, it is vital to check the medication section of a support plan to gain knowledge of each medication and more detailed information of which are routine, with of standard prescription, or PRN, to be taken when necessary. Communication needs of an individual with autism. According to the National Institute of Mental Health, communication needs for an individual with autism depends on their intellectual and social development. Some individuals with ASD may not be able to communicate using speech or language. Some may have very limited speaking skills, and others may have rich vocabularies that enable them to talk about specific subjects in great detail. These are the different approaches which have been identified to be effective when communicating to a person with autism. Getting and keeping their attention. Always use their name at the beginning so that they know you are talking to them, not terms of endearment. Make sure they are paying attention before you ask a question or give an instruction by identifying behavioral patterns that indicate concentration. Such information can be obtained from family members. Use their hobbies and interests or the activity they are currently doing to prompt communication, build trust, and engage them. Processing information. To avoid an information overload where no further information can be processed, use specific keywords, repeating and stressing them. Pause between words and phrases to give the person time to process what you said and give them a chance to think of a response. Don't ask too many questions. Use less nonverbal communication, e.g., eye contact, facial expressions, gestures, or body language. Use visual supporters, e.g., symbols, timetables, social stories, if appropriate. Be aware of the environment, where there is noisy or crowded, that you are in. Sensory differences may affect how much someone can process. Avoiding open-ended questions by keep questions short and ask only the most necessary questions. Being clear. Avoid using irony, sarcasm, figurative language, rhetorical questions, idioms, or exaggeration, as autistic people can take these literally. If you do use these, explain what you have said and be clear about what you really mean to say. Reactions to no. Try using a different word or symbol. Autistic people may be confused about why you said no. If it's an activity that they can do later on that day or week, try showing this in a timetable. No is often used when someone is putting themselves or others in danger. If it's a safety issue, look at ways of explaining danger and safety. If you're saying no because someone is behaving inappropriately, you may want to change your reaction to their behavior. Try not to shout or give too much attention. A calm reaction may help to decrease the behavior in time. Set clear boundaries and explain why and where it is acceptable and not acceptable to behave in certain ways. Mental health needs of an individual with autism. According to the National Institutes of Health, individuals on the autism spectrum are at an increased risk for mental health conditions compared to their neurotypical peers. Adults with ASD may struggle with the following. Time management. Individuals with autism struggle with time management due to their tendency to fixate on activities. In order to manage such behavior, it is important to create a schedule for their activities and stick to it. Sensitivity to the environment. Carers need to identify triggers that may prompt an individual with autism to react negatively to an environment or situation by checking the PBS plan. Feeling a sense of isolation. Involvement of family members in the support of individuals with autism is crucial. Carers can introduce playdates with friends and neighbors with the permission of the family. Autistic individuals should be encouraged to speak up with the assurance that they will be heard. Difficulty paying attention. The earlier discussed communication approaches should be implemented by carers seeking to gain and maintain the attention span of individuals with autism. Feeling anxious in social situations or becoming easily overwhelmed. Carers can support individuals with autism by identifying triggers, reducing drastic changes, and providing relaxation techniques by engaging in breathing exercises, swimming, and so on. Difficulty maintaining relationships. The key is to build a relationship with an autistic individual that is centered on mutual understanding and the willingness to compromise and adapt. Thank you for joining us today as we explored the intricate world of autism spectrum disorder, or ASD. Your understanding and support are vital in making a positive impact on the lives of individuals with autism and their caregivers. If you found this video insightful, please show your support by liking, sharing, and subscribing. By doing so, you contribute to spreading awareness and providing valuable information to a broader audience. Stay tuned for more enriching content from OC Management Consultants. Remember, your engagement can make a world of difference.